Hi, my name is Jessica Bishop, and for my social work response presentation, I'm going to be presenting trauma-informed care with incarcerated individuals. So for my problem summary, trauma is an event in which there is physical harm, the self is wounded, or even when a person is directly experiencing witnesses or learns about a violent event is damaged by it. There can be firsthand trauma, which is a person who goes through that event. There can be secondhand trauma, which is also a person who hears of that event. And sometimes they know someone who went through that event. And then there's also third hand trauma, which it can be a professional who is also discussing that event. The person who is involved in the criminal justice system has their rights taken away and must adapt to essentially a new life with different rules and regulations. So just by being incarcerated, that can be traumatizing for that person. um, they're completely coming up with a whole new or completely going through a whole new life. They're essentially being incarcerated. They're losing all connection to their support system, all connection to the outside world, all connection to anything that they were once involved with, whether it be community or any resources, mental health, substance use, anything like that. According to the Diagnostic and Statistical Manual of Mental Disorders, trauma is a stressor in an individual's life, such as exposure to death, threatened death, actual or threatened serious injury, or actual threatened sexual violence. In 2016, it was reported that 48% of inmates from their sample met diagnostic criteria for PTSD as compared with 4% in the civilian population. Studies have shown that incarcerated women with post-traumatic stress disorder, PTSD, report a much higher rate of witnessing violence than the female population in general, and that many of them designate such witnessing as their most serious trauma. Problem summary continued. In the absence of effective trauma-informed tools, prison systems may develop institutional trauma, becoming highly reactive and reliant on management by crisis. Inmates begin to reenact the dynamics of their chaotic and abusive families. So when a incarcerated person is incarcerated, they essentially create a new dynamic and a new family. So what they're used to is what they are relating to their incarcerated family. Since they are around other inmates, they essentially become their family, and everyone has a designated position in the family. It has been reported that incarcerated people often feel safer in their private spaces, such as cells, or in supervised or structural public space, such as a chapel, rather than public spaces like showers, reception, or on their unit. It has been reported also that some people also don't feel safe in their cells because they're not safe with their cellmate. The consequences to trauma inside the prisons result in incarcerated persons having post-traumatic stress symptoms such as anxiety, flashbacks, depression, avoidance, hypersensitivity, hypervigilance, suicidality, and difficulty with emotional regulation. This problem relates to mass incarceration because there are more possibilities to witness crime and go through trauma. Incarcerated persons tend to underreport their trauma because they may not trust clinical staff with disclosure of their trauma histories. Sometimes clinical staff are viewed as the enemy. Unfortunately, sometimes they feel if they report, they're not going to get the services they need. Not every prison has the correct services. Both male and female may underreport sexual violence and symptoms of sexual trauma, even to researchers, either because they do not consider them to be out of the ordinary or because of guilt and self-blame, or especially for males, a sense of shame and fears about their sexual identity. Male and female incarcerated persons also learn not to report troubling psychiatric symptoms and to manage them on their own as a way to maintain a greater degree of autonomy during institutional stays and limited ability. This tends to be especially true for male inmates with histories of past victimization who have been shown to be at a slightly greater risk for prison sexual assault than men without such a history. So my proposed practice or policy intervention. So how will the policy program or policy work? What are the key characteristic of the program or policy intervention? So the program that I chose is educating staff and inmates. So the program or policy will work on educating the prison staff on trauma-informed care. The key characteristics of the program intervention will be raising awareness on trauma and how it affects those incarcerated. It will start with the prison staff and it'll trickle down to the inmates as well. Who will be targeted? Who are the specific populations, demographic characteristics, and the geographic area on which you will focus? The specific populations that are targeted are those who work in the prison and those who are incarcerated. The geographic area will start small to see how effective the program is, and then we'll travel throughout to other prisons. So it'll start in one county, one community, one prison to see how it's going. And then it will slowly progress to become hopefully a policy. Right now it'll be a program, right? So hopefully eventually it'll go into a policy that all prisons will have to follow this guideline to become trauma informed. Who will carry out the program policy will be persons, entities in the criminal justice or social work world, both or neither. So the prison administration of the selected prison will carry out the program. It will be the administrative staff that will schedule trainings and hire trainers to come in. Social work will ensure that the program is being followed and that they can provide the proper mental health services as needed, right? Because with trauma informed care, there will be trauma that comes out from it. People will report trauma. So we want to make sure that not only is this program educating people, but we have the resources to back it up and to follow what we're doing. So more counselors to talk to, more social work staff to be alert and to provide those additional mental health services. So why will this intervention work to address the problem? How will your proposed program address the key components of the problem or issue? This intervention will work on addressing the problem by making inmates and staff aware of trauma and making them trauma informed. It will also provide training on interventions and coping skills should inmates or staff disclose trauma. So we don't want to just educate the inmates and the staff. We also want to provide interventions and coping skills so that if a client is not ready to address their trauma, because we have to meet people where they're at, if they're not ready to address their trauma, then they've gone through the training, so they are able to have some coping skills in their toolbox until they are ready to fully address their trauma, because we don't want to re-traumatize them by forcing them to talk about their trauma or go through their trauma, but we also want to provide them with the tools so that when they are ready, they're able to get to that point. How does this program build on current knowledge of the problem and past attempts to solve it? So the National Institute of Corrections supports training in several evidence-based curricula on restructuring criminal thinking and developing pro-social coping skills. So the use of present-focused cognitive, behavioral, and coping skills treatment with strong educational components have helped stabilize inmates with PTSD and substance abuse problems. So manualized, present-focused approaches to trauma, such as seeking safety, have been effective with offenders without causing distress or decomposition that requires attention from prison mental health staff. So there are some programs that have been in place, but they're not fully effective. Some prisons do not have this. The program that my intervention helps inmates and staff understand trauma and trauma-informed care. It educates them better by providing training and services. So since not every prison has this, they will hopefully be able to make it more known and make these programs, because the Seeking Safety program is a great program. Hopefully they'll be able to run with these programs and continue to work on trauma-informed care throughout prisons. How does this program promote social justice and other social work values at the criminal justice and social work interface? This program allows clients who are involved with the criminal justice system to utilize mental health resources. It is making the criminal justice system within prisons more aware of trauma by implementing trauma-informed care. It also aligns with social work values of dignity and self-worth as a person, service, and social justice. Clients who are involved in the prison system are entitled to mental health treatment and the correct treatment. They deserve to have the same access to mental health and substance use treatment as those that are not involved, that are not incarcerated. So I know right now I do work with one current prison because I do work in child welfare. So unfortunately, there aren't that many resources inside the prison, especially since COVID. No one really talks about trauma-informed care. The inmates are, the incarcerated persons are just sitting in there, not really participating in programs, not really doing anything. And this is a PA prison, and it's really unfortunate because it is a county prison. The clients the program that I'm proposing, I think it will help those clients because, you know, they are, one of the social work values are dignity and worth of a person. Sometimes incarcerated persons are not treated like people. They don't receive the same services that they would if they were outside of prison, such as mental health and substance use treatment, which is so important for them, especially nonviolent offenders. There are so many substance use charges that clients are incarcerated for, and they're not reaching to find what did they go through, what trauma did they go through, what mental health services do they need. So I think that those social work values will really help promote social justice. The narrative logic model, the inputs are, this program will need a certified trauma-informed care trainer who is able to gather a curriculum for the training. It will need community volunteers, resource packets, and educational videos. It will also need a safe place to have the training. Since the training will be completed also by the incarcerated persons, there will need to be a safe place for them to complete the training, such as the visit hall or gym area already in the prison. This will allow for follow through of policies for safety and confinement. The staff will be able to complete their training off the prison grounds, so they'll be able to go to a separate place than where the incarcerated persons would be. The input chosen helps facilitate training on trauma-informed care. Most of the current approaches to counseling with offenders focus on coping skills, behavioral management, and impulse control. These options, while valuable, tend to ignore the deeper, devastating impact of trauma. Trauma-informed care emphasizes creating an environment that fosters a sense of security and safety to allow and facilitate processing of trauma. So the activities, so I did 3, trauma-informed care through education and lectures. So the implementation will be provided by a trainer who will be certified or licensed, community volunteers, and prison custody and civilian staff. The service will be delivered in person through lecture, educational videos, and educational activities. Trauma-informed care, mental health counseling, individual and group, will be the second service. The implementation will be provided by a mental health agency that is contracted by the prison. The service will be delivered in person by licensed professionals who are social workers. And the last one is trauma-informed care through psychiatric evaluations to monitor and diagnose PTSD and complex trauma. The implementation will be provided by APNs and psychiatric doctors. It will be delivered in person and through conversations and evaluations. These activities and services are chosen because they allow for trauma-informed care while producing resources. This allows clients and inmates to advocate for their well-being and allows them to be provided the correct services. So outputs, trauma-informed care through education and lectures. Prison staff and inmates will understand and be educated on what trauma-informed care is, what it entails, and learning how to identify and cope with trauma. Trauma-informed care, mental health counseling, individual and group. Inmates will become educated and able to talk to a professional regarding their trauma and will be able to work on healing. Trauma-informed care through psychiatric evaluations to monitor and diagnose PTSD and complex trauma. Inmates will receive proper diagnosis, which will allow them to receive proper care based on their evaluation. So intermediate outcomes. So the intermediate outcome for all services and activities is for all participants to be well educated and informed of trauma. Hopefully from that, they are able to build on that and essentially be able to become aware of what trauma is and understand where trauma comes from. And it kind of plants a seed and helps them develop to be more understanding of trauma-informed care. So long-term outcomes, the program will reduce the number of misdiagnoses. It will reduce the number of further traumatizing and already traumatized incarcerated persons. It will reduce the number of crises events related to trauma because the clients and staff will have knowledge and understanding with how to proceed in crisis situations. Staff will be educated and provide correct resources for incarcerated persons. Statistics of negative events inside prisons will be much lower, and it could reduce recidivism of inmates because they receive the proper diagnosis and treatment. These are my references that I use throughout, and that is my presentation. Thank you so much and have a great day.